Hi, we're here today to talk about Epro and our partnership programme with the Access Group. We're delighted to be partners with the Access Group and we're really looking forward to seeing how this can develop over the coming years to help the NHS. Epro was formed over 20 years ago by an ex-NHS clinician who'd become frustrated with the paper-based processes across the NHS. Since then, we've developed our unified digital health platform to really help clinicians be more productive and ultimately help achieve better patient outcomes. Clinical correspondence is at the heart of our platform, and the letters that we produce and create in Epro can now be fed directly into the Rio EPR. Our mission is very much about doing the right thing for the NHS, and we truly believe that this partnership with the Access Group is another example of doing the right thing for the NHS. In the next few minutes, you'll see a little bit more from my colleagues about the Epro platform and what we're doing in trusts and health boards across the UK to help make clinicians' lives that little bit easier and ultimately support the patient journey.
Epro began over 20 years ago, and at that time our main bread and butter was clinical correspondence and digital dictation workflows. However, since then we've evolved our platform and now provide over 14 different solutions for the NHS, some of which include AI speech, referral management, discharge planning, Epro mobile and clinical outcomes, along with a range of others that you can see in the diagram behind me. Our partnership with Rio enables clinical correspondence created in Epro to be viewed in your Rio EPR with seamless integration, essentially operationalising your EPR. I'm so proud to work for Epro because we really truly believe in creating a dedicated, lasting partnership with each of our customers, even after business as usual. We have a range of talented and dedicated staff who have extensive experience in healthcare and health technology. We have a full implementation methodology, a full range of training materials, as we know everyone likes to learn differently, a dedicated UK support desk with a dedicated resource for your trust and health board, and we also have a clinical support to advise on clinical risk and clinical safety issues. And on that note, I'll hand over to our in-house CCIO, Dr. Chandy.
Here at Epro, we are proud to have one of the most well-liked pieces of clinical software deployed in NHS hospitals around the UK, as you can see here from some of our testimonials. We also have a patient-centric model, and this means that we also align with PRSB standards for our clinical data, and more recently, we've also taken up the quality partner status with the PRSB for their outpatient letter standard. We also have some statistical illustrations of how our software benefits organisations around the UK. A recent deployment at the Liverpool Heart and Chest Hospital has shown that they can eliminate a backlog 74% within 6 months. And then more recently, they've completely cleared that backlog within a year. And at a different client side, we are also aiming to drive efficiency by making the most of the resources available. A speech recognition pilot has led to the dictation time reduced from 10 to 3 minutes, that's 70% improvement. And then also letter creation and delivery from 30 days on average down to just 3 days. And so taking that as an organizational benefit, we also know that translates to real individual benefits at a patient level. We have heard of a single case study of a taxi driver receiving a letter confirming that they can return to work much earlier than they would have otherwise because of Epro. And we're proud that we're serving the public in that way as well. Our workflow is intuitive, and we're very keen to make sure that clinical data is presented in a clear and efficient manner and in a meaningful context that allows clinicians to provide the best care that they can with an intuitively navigable interface. And we also have multi-device support so that all our data and presentations can be seen on mobile devices in a very similar manner that they are on desktops. So overall, for clinicians in the modern NHS, we want to provide the best possible care at the right time for the right patient and have tools to assist us in doing so. And Epro is proud to be one of those tools, and we're particularly excited now to partner with the Access Group and Rio going forward. Thank you very much. And if you have any further questions and want to find out more information, please contact us as shown.